Welcome back to Artful Wellness series. Thank you everyone for a wonderful first week last week. We got a lot of positive feedback and we're so happy that everyone enjoyed the session with Jim McKenney talking about our personal relationships to addiction and mental health. I'm very excited about today. We have our psychotherapist, Ria Guifarro, who's here, and she's a very, very skilled and exceptional psychotherapist. So we're excited to learn a little bit more about her and her personal stories. So we're going to just start off here, kind of just chit-chatting about, I guess, our personal relationship of how we got to know one another and where that all stemmed from. So again, my name's Alex. I'm the clinical director here at Addiction Rehab Toronto, and we have Ria here. So welcome.
Thank you.
You're
Thank
welcome.
you for that.
So we're taking it back probably over 2 years now, or almost 2 years.
Close, yeah.
Yeah. And, today we're hoping to talk a little bit about mental health, obviously, but we thought it would be interesting to address mental health in the field, because how do professionals who are, supporting individuals who've experienced some pretty severe trauma in their lives and, maybe have some scary experiences happening to themselves within the field, manage their own mental health. So that's kind of where we want to go today. So I thought it would be interesting if we shared with everyone kind of our first night on shift together here at the center, which was, scary to say the least.
Yeah.
But, basically we had a client who had a really tough day and came out of a family session that, didn't go so well. Mm-hmm. And the response from the client was
terrifying.
Yeah, it was really scary. Feelings of, true fear of our lives.
Yeah.
Would you agree?
Yeah, I wanted to hide. And I was really scared that I was going to die.
Yeah.
Laughing, funny, not funny.
Yeah.
Yeah.
Exactly. I mean, with obviously not going into too much detail, I want to focus on, I guess, that response we had and the impact it might have on us as professionals. I mean, I know after the event happened, I jumped into the director role, and my main concern was you and your well-being. We left the building, finally being able to be safe and kind of let our emotions out, because for the last 2 hours we really had to be numb and not allow someone to know or give them any, I guess, I don't know what you would call it, maybe just not let them know that we're being affected.
Right.
So when we left and we were able to actually let those emotions express themselves, we had two very different responses.
Yeah. Yeah, for sure. We were walking to our cars together, I think, and I was going to try to wait till I got into my car to have that emotion. But you were really sincere and you were just like, are you okay? Are you sure you're okay? I think you should take the day off tomorrow. And I just felt so seen and so heard that I just broke down and cried.
Yeah.
And while I was crying in front of you, I'm like, get it together, upset with myself, but could not stop it, Yeah, and I remember asking you if you were okay, and you were laughing. You're like, yeah, I'm okay.
Yeah, and that's what I mean by the two different responses. I mean, as I said, jumping into the role of director and knowing that one of my team members, was, I could tell, very impacted by a very traumatic event.
Yeah.
My biggest priority was just making sure you were okay. And, I think I fell apart later on. The laughter turned into tears eventually.
Yeah.
But it's a significant story because this isn't unique to just you and I, right? I mean, it happens to people all the time, and probably more so in centers that aren't private.
Well, before we even get there, I think it's interesting to note that on a typical day, I would have been doing that family session alone. And I listened just to my intuition, I think, and asked for support. And you being as great as you are, you offered that hands down. And so had you not been there, I would have experienced that all by myself. Yeah. So just, I think, having the support, being heard and validated in the beginning of the process, having the support, and then being allowed to share that experience with you, as traumatic as it was, I think like really, really helped my process anyway, you know, not having to be alone and feel alone, you know?
Yeah, absolutely.
Yeah.
And I think too, I mean, it's a testament to know that two professionals, because you're a psychotherapist, and with psychotherapy comes, you know, very specific guidelines of, you know, the approaches you can use and the things that you talk to about with people.
Yeah.
And I'm more the behavioral side of things, and I guess the education piece, and obviously the counseling as well. But to be able to be two completely different professionals from two completely different disciplines, almost like, yes, the same topic of mental health and counseling, but different in what we do on a day-to-day basis, to be able to sit in a room and fully support one another. You know, with egos aside, you know, 100% almost you and I come first before the other people, as it should be for safety, you know?
Yeah.
And I don't, you know, I think that needs to happen more often within
I agree.
the fields or any field.
Yeah.
So I think that too is an interesting discussion. Just that interdisciplinary approach, you know? It's really important, and I think it benefits, you know, the family and the individual a lot too.
I agree, because I remember in that session, I think the family also felt more supported because we were both there and we could offer different perspectives. So yeah, I think that was really beneficial for everybody involved, you know, the client, the family, and then staff, right?
Yeah.
Yeah.
So in my last interview, I was sitting down with Jim McKenney, and we had a wonderful conversation about, you know, the importance of lived experience. And obviously a lot of the root of that conversation with him was surrounding, you know, his own personal story and journey with recovery and addiction. And I said to him in the podcast, you know, I think there's two sides of lived experience here, you know, working in the field and at a center like Addiction Rehab Toronto. One being obviously the lived experience with addiction, but I think another one that kind of gets often overlooked is the lived experience for things like sexual assault and trauma and grief and loss and stuff like that. So my first question for you today is, what lived experience of yours benefits you the most when working with clients?
So I think it depends on the kind of client I'm seeing. If I'm looking at relapse prevention and addiction-specific topics, then the lived experience I draw on is being married to a drug addict and what that lifestyle looked like and felt like, and all the implications that come with that lifestyle. That I think really helps me with empathy and validation, and I think it almost evens out a power dynamic, an unsaid power dynamic, because many times if I haven't experienced the addiction component, I've experienced the other stuff, right? Like struggling for money or moving around all the time because couldn't afford rent, or dealing with Children's Aid Society, right? So I think having that experience really helps solidify the fact that I'm non-judgmental, and so that clients feel open to discuss anything they want without fear that they're being judged, because I've been there, minus the addiction, right? If I'm looking at it, if I'm dealing with someone who's needing anger management and that kind of stuff, then I could draw on living with an abusive partner or being charged with assault, you know, having a criminal record. That lived experience helps me really empathize and validate that area. And so having gone through all these things, you know, a lot of people say people don't change. And so I really like when they say that to me anyways, especially when they don't know where I come from.
Yeah.
Because then it's a great teachable moment.
It's a great point.
Yeah. But yeah, I think those experiences help.
Do you think that, you know, do you think it would be fair to say that if individuals are in a counseling position or working with individuals who struggle with addiction, a lived experience on some level is almost a requirement or a necessity?
I think in actuality, I think everybody has some sort of lived experience that could help, whether it's experiencing depression or anxiety, right? I had postpartum depression after my kids. That is very, very common. So I think there's a lot of things that can help a counselor link to the client, even if they didn't recognize it beforehand. Because we all experience trauma to some degree, or hardship or adversity, you know, and a lot of us just come into the field wanting to help and being these caregivers and sometimes codependent, right? And then we really have to, through our own therapy and through school and stuff, we have to keep that stuff in check.
Yeah,
but
absolutely.
I think that, you know, we all come with some sort of helpful baggage, I guess.
Which is synonymous to, again, the conversation that I was having in the last session about mental health being a human experience, you know, and it doesn't discriminate against people, anybody, through money or gender or age or, you know, status or culture. I mean, it's something that we truly all struggle with. And to your point, you know, pretty much everyone, you know, you'd be really hard set to find someone who says, yeah, I've made it through life with like no cuts and bruises along the way.
Yeah, for sure.
I've never had an anxious day. I've never felt sad. I've never not known where that sadness comes from.
Yeah. Or I've been in control of everything, my thoughts, my emotions, and my behaviors.
Yeah.
Like, I don't think really anybody could say that.
Yeah.
Yeah.
Exactly. So going back to, I guess, the traumatic experience we spoke about in the beginning, you know, what we would call that would obviously be trauma. But again, professionals can experience things like residual trauma when supporting a client. And that basically, and you can correct me if I'm off here at all, but, you know, it's the residual trauma is when you're sitting with someone who has, you know, an exceptionally difficult story, or a story that's close to your heart that may be similar to something you've endured, and that you're kind of taking on their emotions and their experience of trauma, and it's so significant, right? Hearing stories of individuals who've just, you know, gone through just the most unimaginable horrific experiences. And again, it doesn't necessarily have to be horrific, I don't think, but it can also, I think, get brought up when it's something similar to maybe an abusive relationship or, you know, something that's close to our heart. So how do you manage that for yourself? You know, when you're in a psychotherapy session and you're talking to someone and you're impacted, you can't deny that you're not impacted. You're empathetic, you want to understand, you know, you're a loving individual. How do you keep that separate, or do you keep it separate?
So with psychotherapy, you are not supposed to deny it, right? You have to be very in tune with your internal state and take that personal inventory. And so when I am impacted, I do a quick check internally, and I ask myself, what do I need right now? If that means I need to take a moment, then I take a moment. Generally, when I say, what do I need right now? It's that I need to not be as empathetic or overly empathetic, and recognize that that's not me who lived through that, that's them, and really just be there for the client, right? To be witnessing, not to be traveling through their journey together hand in hand, right? I'm there to witness their journey. And so if I can disconnect and take a step back, that allows me to really get through the session without taking the client's emotions, you know, hearing something sad and how that would not be beneficial if I started to cry and the client is like, oh my gosh, you're going to be okay, you know? So really, first I think is doing the inventory and identifying what's going on. And then second would be to disconnect a little bit, you know, in a loving way.
Can you remember a time where that would have been really difficult to do, though?
Yeah. So specifically, I remember I was working with someone who had been charged with child pornography. And the age of the people on their computer was 15-year-old girl, and my daughter at the time was 15. And I had to take a second and leave the room and really like get myself in check, because depending on how I respond to that situation can either limit or liberate that session and that client, and, you know, prevent or promote them from sharing with me. Therapy is not beneficial if people are not sharing openly, right? So I took a moment, did my check, and then went back and soldiered through.
Yeah. No, but it's really tough.
Yeah.
To do that separation.
Yeah.
I think, you know, sometimes we might get stuck in, okay, this is the way it's supposed to be, you know, making that separation, not allowing it to impact you, taking that moment. And maybe 9 times out of 10 we're successful in doing that. But, you know, it's also okay that one time too. I mean, the way you were impacted is, I think, a reasonable response to.
Well, and it's what you do with the reaction, right?
Yeah.
So, I mean, I'm really diligent with my own therapy. Like I have my own psychotherapist. I do other things to help manage that. And so taking the second and the space just to allow myself to quickly process and going back, yeah, I think that's okay. Had I went back to the session and then allowed that transference to really take over the session, not okay. You know?
Yeah.
So it's what you do with the response, right?
What are some of the other things you do for yourself that are helpful in managing that?
Well, one of my best friends is in the field, and so I often debrief with her if I have a really hard day. I work out, I, you know, try to do diet and exercise, healthy living. I do my own counseling, gratitude journal. I have tons and tons of like inspiring things on my Instagram feed. You know, that kind of stuff helps me. Yeah.
Yeah. Those things are so important in the field. And I feel like we need to almost lead by example. I don't know about you, when you sit down with someone who's like struggling with anxiety, or, you know, they ask that question like, just tell me what to do. You know, and you're like, obviously I can't tell you what to do, but these are some strategies that I even use that I find helpful, you know, when I'm experiencing anxiety or stress or maybe depression or a lack of motivation or something like that.
Yeah.
I think it's really good. And I know here at ART, we do a lot of that kind of stuff. You know, the whole team leads by example with our communication to one another, all the way down to the clients, right? If we're trying to teach and empower everyone to be assertive and, you know, communicate their needs and communicate their emotions through expressive language, you know, we want to try and do that too with one another.
100%.
And model that behavior. So I think, and going back to your point of another question, which is people don't change, or maybe not a question, but a statement of people never change. Well, in fact, they do. And they very well can. And this is how I've changed and what I've used to really help me. I think that's just so beneficial.
I agree.
Yeah. What do you find in the field? Because we teach a lot about different concepts, and we do a lot of psychoeducation for codependency and relationships and self-esteem and anger management and stuff like that, and communication. What do you find are some things that from work you take home with you to help you in your day-to-day life?
Well, there have been a few concepts that have really actually changed my life. I think I didn't hear the word boundaries until I was like 27.
And you're only 30 now, right?
I'm only 28. So that concept really changed my life.
What part changed? Sorry to interrupt, but was it just learning that boundaries were normal and that they were valid? And
learning that boundaries are protection, they're not punishment.
Yeah.
And really incorporating boundaries into my life and finding a way to do that in a healthy way. I think before I struggled a lot with codependency, and I would often feel guilty for having a boundary, and I'd feel selfish and not feel like a team player in my relationships. And once I finally got the grasp that boundaries are here to protect me and to protect our relationship. They're not there to punish you.
Yeah.
That really changed everything for me.
Yeah.
Yeah. So boundaries is huge. And validation. I love the concept of validation, and we do it here in DBT. And the ability to identify validation and then to express before having a conversation that, look, all I need right now is validation, really helps me. A, it gives whoever I'm talking to a roadmap into what my expectations are. And B, it validates me, right? And so my needs are met at the end of the day, whether, I've said validate me and they're only validating me because I asked, who cares? They're validating me, And so identifying the need, communicating it, and then having it met, it's just...
So reinforcing.
Yeah, well, and it creates such shifts in relationships, validation. The ability to be seen and heard from your partner, I think is a game changer.
Yeah. I do, as you know, I do the family program a lot in the evenings, which is our program to bring in the family members of the client that's at ART. And I don't think we have ever gone through a family program without talking about the importance of boundaries. And, in romantic relationships, I feel as though it's a little bit not easier to understand, but I guess maybe it makes sense to grasp that two people have boundaries. I find that with families, like especially families that are dealing with someone who's in active addiction, who's taken their money, who's destroyed their home, who's kept them up all night. It's really hard to say, you need to now go and validate this person and their boundaries when they come out of treatment. It's really hard to teach that. So I don't know if you have anything on that piece, but just... it's understandable. Validation becomes a little bit tricky when there's been a lot of hurt and I guess frustration. Yeah. Well, I think, a lot of times what has happened is the person who's struggling with addiction, they infringe upon those boundaries, especially when they're in an altered state. So a lot of times this happens and they're not even fully aware of the consequences or of the damage. You know what I mean? And so when we look at validation, we're not condoning the reasons why you're struggling. We're only validating that you're struggling. And so, even with my ex-husband, he would be in and out of active addiction. And while I would be so upset with him, I'd be so angry and hurt and let down. If he was sober that one day and he was struggling and he was mad, I still validated, yeah, you seem like you're going through a hard time. Yeah. I didn't say, well, these are natural consequences of your addiction. Right. I didn't want to shame him. I just wanted to acknowledge that I know you're going through a hard time. I get that. Yeah. And not, so I guess what you're saying is we're validating their experience, but I guess the behavior we're not validating. So we're not going, I know you're going through a hard time. It's completely reasonable. You punch someone in the face. Right. Well, it's like if someone is scared of dogs and a chihuahua comes up and they jump on the couch, I'm not going to say, it's only a chihuahua, right? The dog's tiny. No, I'm going to say, wow, you look like you're really scared. Yeah. So I'm not looking at the reasons why. I'm only looking at the emotional experience of the person. Yeah. Yeah. And it goes across, again, bringing it back to the discussion of even the team and working in the field with our own mental health. I don't know about you, but when, my boss or even staff or when we support one another as a team and we say like, listen, you seem really stressed out and things are really overwhelming right now, it really helps. It helps being acknowledged and seen and heard, as you mentioned before, of that specific experience, or it's you've been working really hard. You've been doing everything you can. I can tell that you're really doing your very, very best. Right. So it's important across, I think, so many different platforms. maybe the next question we can move on to is, we're two women here talking today, which is wonderful. And in the field, I think as it does, there's challenges in every field. What do you think would maybe be the biggest challenge, or are there any challenges working in this field, being a woman?
So I think that dealing with anger management, sometimes when the clients are male, that can be a struggle, being a female. Also, I think that a lot of people still have this notion that females are emotional. And so when I'm going through psychotherapy and I talk about emotions, it's almost dismissed at the beginning because it's like, yeah, of course you're talking about emotions, And so I think that can be challenging at times too. Having the information to deliver that information to the client non-gendered sometimes can be tricky. So I think there's that aspect in terms of the therapy. Also, there's going to be challenges dealing with vulnerable population or sometimes reactive populations and being a woman. Also, I come from abusive relationship, right? So that also is layered in there somewhere, that I think gender plays a part of. Yeah. What about you?
Well, I completely echo what you're saying, especially with the anger management piece. I mean, as the clinical director, I'm quite often sitting down with an individual, male or female, and I'm the one who has to, discharge them or place them onto a behavioral contract or, sit down and have some sort of disciplinary conversation based on, something that they've done or a policy they haven't respected or a behavior that they themselves have had towards the staff or clients. And I find, with some men, it can be, or male clients, it can be a little bit challenging. Not because necessarily they make it uncomfortable. I think it comes from more within.
Okay.
I think it comes more from, am I strong enough to do this? Because naturally you're, again, empathetic and loving and you want to be understanding. That's what you're trained to do. Right? We're not trained in school as counselors to say, I want to be, punishing someone or disciplining someone, right? Yeah. So for me, that took a little bit of time to get used to in my role. And it can be a little bit tricky sometimes because leading up to that event, that individual may have had a very close relationship with you. You may have shared a lot of intimate conversations. They may have had a really positive, treatment up until then, so you want to put any biases aside. You want to be able, and that's not so much gender. I think that's more also just being in the role and doing it ethically and having a set of principles that you make every decision on regardless of, who the person is. But it can be a little tricky. And I've had, clients obviously come in when they're intoxicated on their first day. And, you always get some sort of remark like, yeah, you look exactly like my ex-wife who I hate, so I'm sorry, how do you kind of respond, well, you kind of just, I guess, crack a joke or something or deflect it away and then hopefully be able to not allow that, experience of theirs to impact anything moving forward.
Or equally tricky, you remind me of my ex-girlfriend who I love and I'm still in love with.
Exactly.
I want to get back together with.
Yeah, exactly. So, it's, I think being aware, I don't think before this position I was super mindful of my gender.
Right.
I was raised by, a feminist, being my dad, and, who never really made me feel like a girl. So I guess I walked in thinking, oh yeah, no, why would I have any different responses or no one will ever look at me differently. And I think because of this role, it's almost like my gender has become very aware to me. I've been very aware of my gender. Yeah. For good and for bad, right? Yeah. Pros and cons on both sides, but yeah, it's interesting. It's very interesting. And just, again, trying to, manage the situation as ethically as possible.
Well, what about if you take the clients out of it and put staff into it? Mm-hmm. Does gender ever affect that?
Yeah, absolutely. I mean, that's a really good question. And I'd probably say the same thing, never truly cognizant of it until I came into this role and realized that being a director and someone who's a boss for a lot of male staff who may be older than me, may have lived experience through addiction, therefore may feel as though they really understand it in a way that I may not understand it.
Right.
It can be a little tricky. So what I do is, and what I love maybe as much as your validation piece, is the transparency. I think it's so important, Rhea, in this field, and going back to like that mental health piece and how we manage it ourselves, is that we have to be transparent as a team, and if those are going to be tough conversations, like, hey, it really seems like you're, frustrated. Is there something that I did? Did I overstep? Do you want to sit down and talk? I want to have that relationship with every single one of my staff. Yeah. And I think, in some of those conversations, it has been, brought up that, it's a little tricky having a boss who's 25 years younger than me, when I've been in the field 30 years, yeah, and is someone I might not be familiar in listening to. And, I think hopefully through that transparency and communication, collectively we can move forward. Right. On sort of the same level with one another. So, thank you for asking that, though. And yeah, I think it's an ongoing conversation for sure. But I very much appreciate you coming in today.
Thank you for having me.
Of course. Yeah. I think what's so wonderfully special about you is your story. It's much like Jim McKenney last week. He has such a remarkable story, and there's a lot of admiration, I think, for you, Rhea, just obviously for your skill, 100%, but also for the fact that you just beat the odds in a lot of ways, right? And you're someone who's just proves to everyone that you can change and you can, defy the odds and move forward from really, really difficult circumstances. So thank you so much for sharing that. Yeah. And hopefully we'll have you back soon.
Yeah, I hope so.